person broke his or her ankle, it felt great with just pain pills. Why not just keep getting the pills to fix the pain?
Well, that is a good question, and that's exactly what we were exiting the last segment about. Narcotic pills cannot be kept for a long time. New regulations are designed to limit the narcotic use because we want to limit the addiction capability of the high addiction capability of these medications. Regulations tell us almost how frequently we can give them. Reasonable regulations, how long we can give them, and we have to clinically justify their use. We can't give them pain medicine if another doctor is prescribing. If you're under a pain management contract with a pain management doctor like Dr. MacNichol, I can't give you any pain medicine at all that requires a prescription other than anti-inflammatories and such medicines. So these regulations are effective. They're monitored by the state. It's illegal for me to write somebody a prescription for a narcotic without checking the state and national record to see that you didn't get a prescription yesterday from another doctor. I will have a printout of all the narcotics that you've received for the last year or more. And so all that is not hidden from us. And it should have been that way decades ago. So we can't give you those medications. We don't want to give you those medications. Our job is to get you better without those medications as much as we can.
Absolutely. In the last 5 years, because of the concern for the opioid crisis and the widespread abuse and misuse of prescription pain medication, state governments, state medical boards, and then ultimately the CDC established guidelines that the physicians are held to follow. It's no longer the physician's option to follow the guideline or not. And any more primary care physicians who used to prescribe a lot of pain medicines for long periods of time no longer are permitted to do that. It's generally required that a physician specializing in pain management be consulted and prescribing medication for long-term use if there's a need for that, partly because there's all kinds of requirements. You need to be, as Mark mentioned, you need to be looking at the state database every time you prescribe. If it's an ongoing prescription, that's every month. You need to be confirming compliance on the part of the person receiving the medicine. That includes demonstrating that there's no other prescriptions being filled.
Through that database?
Through the database. That the pain medication can be accounted for, that it's not being overused. That means pill counts, bringing the prescription in every month.
So you actually ask them to bring the prescriptions in to prove that they don't have leftover pills?
And that's not just a whim on the part of the doctor, it's required by the state and the federal government these days.